Hello, everyone. My name is Dr. Michael Wald, and thank you so much for joining me for this brief and concise conversation, which I've entitled, How Do I Stay Healthy in my 70s? But actually, I stole the title from a current Guardian magazine article, and I thought I would clarify some things and also expand upon the Guardian's article. It was a bit superficial, so let's get into it. And before we do, I just want to state that this information is not meant as a substitute for sound medical or health advice. It is for your education. So based on the article, How Do I Stay Healthy in My 70s, the article pointed out some basic lifestyle considerations. And when I say basic, I mean basic. So I'm just going to pretty much name each of these, but give you a little extra insight about what these different lifestyle measurements are. And well, let's begin right now. So number one, in anyone's mind, should be embracing regular physical activity, engaging in moderate exercises like walking, yoga, and strength training to maintain lean body mass, bone density, circulation. And in my experience, I would say that a bad diet can be made up for quite a lot with a formidable exercise routine. So I'm not suggesting that you should ignore your diet, but I do know from 33 years of doing this sort of work that, and looking at people's food intake and lifestyle, that even the poorest of diets, a person can maintain a pretty good level of health. Not everyone, but a good number of people with rigorous and regular exercise. So regular physical activity supports independence and overall health, and we are talking about aging. And if you would rather not end up or reduce your risks of ending up alone, either at home taking care of yourself or relying on others in your 70s, and certainly if you want to try to avoid the potential of you ending up in a nursing home, working hard in terms of physical activity is a must. And you want to cultivate social connections, nurture positive relationships to enhance physical and cognitive well-being. So we know that positive relationships produce positive emotion, and that's what we want. Participation in community activities to combat loneliness and enrich your social network are fundamental. So you want to stay connected. And there are some health screenings that you want to keep in mind. So you want to stay updated with health screenings for bone density and various cancers. So what does that look like practically? Well, first of all, family practitioners, internists, they do not routinely do cancer screening tests, and unless they have a very strong reason to do it. And you can ask for those tests, but they likely will tell you this. They will say, we don't like to do cancer screening tests because they can be positive from chronic inflammatory things. And if they're falsely positive, then we have to follow these up with other tests. Some of them carry risks, let's say like CT scans or PET scans, and they load you up with a good deal of X-ray, which increases your risk of cancers. But you do want to have your bone density measured. I would say if you're, let's say, 45 years old and older, for every 3 to 5 years, and maybe earlier depending on your current level of health now. That's my recommendation. Also, what was not recommended in the Guardian article is to have a body composition test, or what's called a bioimpedance test. So that's an evaluation that can measure on the body your percentage of muscle, water, and fat, the amount of water in your cells, outside of your cells, something called phase angle, which tells us about the energy or the energetics of cells. It has a lot of these sorts of measurements which are very important to monitor and look at as you're practicing your exercise and your healthy diet and all of that. We need to see the body composition show greater lean mass accumulation over time and less fat, obviously, and proper water balance. But that is not the body composition test or bioimpedance test. Is not a standard test done in medicine. As far as the bone density, just going back to that for a minute, I don't like having people do DEXA scans. That's the traditional way in regular medicine that bone density is checked, because that exposes the person to radiation. There is an Achilles bone density ultrasound method which has no radiation, and that's the one I use. And depending on your feelings about vaccination, including the flu, pneumonia, shingles, you may want to consider those vaccinations. And obviously, no diet about longevity into one's 70s would be complete without mention of adopting a healthy lifestyle. So, in this particular panel here, and also as it said in the Guardian magazine article, you want to focus on plant-based diet to promote longevity. That is generally true. But like all generalizations, they are generalizations. So when I'm sitting with a client, I might in my mind think, oh yeah, so we're going to start with a basic plant-based diet because it's low in inflammatory potential, it's high in fiber, high in minerals, natural plant enzymes, vitamins, for example. But if a person's health shows that they are protein deficient, and that person, does not want to take protein powders, let's say, they might have to add meat into the diet. And of course, if they do, we want it organic and free-range meat as much as possible. But even those healthier types of meats will probably lead to increased overall morbidity and mortality. Not to mention the higher one's meat intake, the higher one's risk of dementia and colon cancer. And meat contains levels of the most inflammatory element in the diet, known as arachidonic acid. So if a person on a plant-based diet, they need more protein, I would tend to use plant-based protein powders. And the number of grams of a protein powder or protein intake that a person would need should be based on their body composition test. So there's a certain number of grams per kilogram of body weight, and that's very important. You should also know that body composition test, and I keep mentioning here, is the number one biomarker evaluation that there is. Meaning no matter what you choose to do for your health, yoga, plant-based diet, taking supplements, if that effort does not increase your lean body mass, it is not increasing your lifespan or health span. That's why it's important to do a body composition test. And you want to maintain a positive outlook on aging and improve mental and emotional health. Personally, I just give no credence to my age, being 59. I can outwork most people in the gym. I certainly can run faster than most people of any age. So I think of myself as healthy. And if those negative thoughts start to get in, oh, I'm getting healthy, or this hurts, that hurts, I don't ignore my problems, but I don't have these problems control me. I don't let my mental attitude get in the way. And while I'm on that subject, as Bruce Lee once said in one of his videos, do not ever talk about yourself in negative terms, because that will manifest negativity in your life. And I do believe that that's true. So when I approach a person who wants to improve the quality of their life and or length of life in the non-disability stage of life, there are certain things that I do. Number one is I review their diet, a 7 to 10 day food plan, to see which is obviously missing, and then I make adjustments. Now those adjustments will be based on what the person's health goals are, what their current health situation is. And then I would perform specific laboratory tests of nutrition and health and inflammation, and then whatever I find that's abnormal, I fix it. Now, another important distinction you should know of is that there are two different ways that doctors can read blood. One is the regular way, where your results of your blood tests are comparing you to other men or women within your age category that were seemingly well when they donated blood, and you're being compared now to the national average or some average of, and maybe of a small population of people, for example. And those ranges are called clinical ranges. So they're not healthy ranges, they're just clinical ranges, meaning that many people, you might know this about yourself, you go to the doctor, you say that something is wrong, the doctor says your labs are fine, and then they send you home. Sometimes there's a few abnormalities on the test, but they ignore them because they're not, let's say, extreme enough for your doctor to be concerned about them. I don't ignore any abnormalities on a test, because if you have even one abnormality, that means you're different than 95% of men or women in your age category. Now, here's the important point. There's also a way of reading labs where I compare you to healthy people. Those studies have been done. And the ranges for healthy people are different than average people. Basically, when you're compared to healthy people, you can have more abnormalities on your test, but that can make very obvious the nutritional issues and health issues that you have that may be hidden in the regular clinical ranges The regular clinical ranges are designed to pick up disease. So once there's an abnormality, you've got it. But the healthy ranges can see disease coming, you see. So very important. Then, when I give nutritional information, it's in the form of diet. It's based on what kind of foods my clients like, what kind of foods they don't like, and what kind of foods have the nutrients in it that their lab tests say that they need. So very important to be aware of that. And then the nutritional supplements are recommended at levels or concentrations that are much higher than the recommended daily allowances. So as I like to say in all my videos, the recommended daily allowances, or RDAs, are the minimal amount of that particular nutrient that a person needs to prevent deficiency disease. So it's just the minimum amount to prevent deficiency disease. That's what the RDAs are. But I also go way beyond those doses because there's plenty of studies that show, we're talking tens of thousands of studies that show that much higher levels of nutrition can promote health in a way that's far superior than just giving someone the minimum amount of what they need. It's like giving someone who's very, very thirsty the minimum amount of water just so they don't die, as opposed to an optimal amount of water so they can thrive. So I look at both the clinical ranges and I look at the healthy ranges, and then I look at the nutrients. I know what the recommended daily allowances are. They're almost always far too low. Your regular doctors will look at the vitamins you're taking if they had occasion to do so, and they would flip. They would say these are so much higher than the RDAs because they don't learn anything beyond that in medical school. So that'll pretty much conclude it for today's talk. Please let me know your thoughts about this presentation, and let me know if there are other topics that you'd like to hear. It was my pleasure speaking with you today, and hope to connect with you soon.